Another edition. We're back, and it's been a little bit, but a lot has happened in our world, your world, my world. And let's start with a conversation. We'll get to schools, as that's a big topic all over the country as far as what to be able to do. You can bring in anybody you want, including an old friend. That's totally okay. Where you are in Florida, the state, there has been a big topic of conversation on social and beyond over the last couple of days that testing, the positive tests have dropped significantly. How much of that had to do with shutting down testing sites ahead of what was perceived to be a major tropical storm / hurricane that really didn't pan out?
Well, I can't give you the exact numbers, but you can clearly estimate the fact that if you have a closed testing center that usually has lines of people waiting to be tested, if that testing center is closed because of the weather conditions, then you're not going to have people tested, and clearly both the positives and negatives are going to go down. There's no question that is a contributor to the numbers. Because if you look at the trajectory prior to the hurricane or the storm that was predicted, those numbers were actually still on the increase. So to have such a drastic change, I think that we can easily correlate that with the fact that they were closing testing centers.
So how can we make sense of two things, and they're different, but under the same umbrella, where we see in areas like California, Florida, and Texas, continuing rise of positive tests, which look to be more in the younger demographic, whereas areas like New York, Connecticut, Pennsylvania have seen a significant drop in positive tests. However, the death rate that they experienced was unlike many other countries, let alone states in this world, in this country.
Well, again, the discrepancy between the different states has to do with the fact of the population in that state. So a high populated state clearly has a higher risk because they're, again, larger cities. There's a lot more interaction and clearly infectivity. The rural areas in the United States, although are seeing some increase, the increase is never going to be the same amount as we see in urban areas because of just the number of people and the actual crowding that's going on. Now, we have issues with other diseases. Keep in mind that COVID is right now high on the list, but we have other diseases that get transmitted because of crowding, one of them, which is tuberculosis. And that is rearing its head again, if you will. So I think that the virus is not over. We're seeing, again, an increase in the younger population, mostly because there is a lot more activities. I think people are basically letting their guard down. They've had enough of social distancing and lockdowns, and they're feeling as if they are willing to take the chance. And clearly the younger population has a higher tolerance to this virus than the older population, but it doesn't necessarily mean that everyone is immune to the high mortality that we're seeing with this particular agent. So a good question. We don't have a straight answer, but I think it has to do with the density of population.
So going on that point, I think what we're seeing, and especially in my world where an athlete or coach, for example, tests positive, there is a pretty clear divide in the reaction to somebody who's asymptomatic. It's either treated as, well, 98% of the people who get this are fine, and they downplay what I'm about to ask you, versus people that recognize that simply being asymptomatic doesn't prevent you from having any type of lingering damage. Are we at a point right now in the medical world community where there is at least some data that would point or indicate to, yes, you can be asymptomatic and you can recover from this and not have the virus in your body, but have lingering effects on organs or bodily, even if it's lungs, as a result of simply having this virus, and it can maybe show its face in other forms, not actually COVID-19?
I think that, the short answer to this is that the likelihood of an asymptomatic infected individual developing sequela to that infection is extremely low. It does not necessarily mean that it's not going to happen, but the likelihood is extremely low. On the other hand, for symptomatic people who may not have sufficient infection to be hospitalized, there may be some organ damage that we're just basically now starting to ascertain, but again, it's not significant or severe and may be reversible. But I think there's more time in terms of collecting data to be definitive about this kind of phenomenon.
All right, so before we get to schools, I'm just going to test my theory on you and know that I don't have anything as far as data or anything in front of me that would point to one way or the other. I know that Dr. Burks came out the other day and said that this is a much wider spread virus. You and I have been talking for months about the high percentage of asymptomatic people that are walking around not even knowing until they're forced to take a test. So it looks as if we've had a pretty significant shift in what to do to prepare or prevent this virus March, April, which is stay home, wash your hands, and if you have to go out at all, just keep as far away from anybody as possible. Don't go indoors. To now, the focus being on whatever you're doing, wherever it is, wearing a mask. Both are fine. Both are good. I'm not pitting them against each other or downplaying either. But my theory would be, based off of that, it looks as if without telling us, people are expecting, at least in the medical community, are just expecting more people to have this. So the mask is actually preventing the person who is walking around asymptomatic in a very high percentage that's not knowing whether or not they have it from spreading it now, as opposed to when this thing first initially hit, with the idea of doing everything you can to prevent it, right? So March, April, we were preventing it. Now in August, we're preventing us from giving it to other people.
No, I think that's a very well constructed point by you to say that the mask is protective of others. And the fact of the matter is that, we've had some significant mortality. So the very, very ill and sick people may have died off. Now we have a younger population which is spreading the infection, and maybe significant numbers of those who are asymptomatic. So again, anything that we could do to reduce the spread of the droplets and the aerosolized virus, it makes sense. One of that is wearing a mask. So the mask is mostly protective of others. Clearly, social distancing is another. And again, staying at home with your own people, again, makes the likelihood of you getting infected from someone, again, less.
So I'll reiterate this point, and then we'll hit on schools before we break. But you've made this countless times as somebody who has worked in other countries, especially when those countries were used and put on a pedestal to highlight all the things that have gone wrong here. But I can't imagine you're surprised to see Japan, Australia, not happy, but surprised, right? To see these countries suffer setbacks, because it's what you've been talking about, where no matter the country, no matter the situation, until the virus is completely eradicated, expect some setbacks. So we've seen now Vietnam, Singapore, Australia, Japan, countries that were ahead of the game, if you will, now reverting back to lockdown.
Well, again, this is not just this pandemic. We use the 1918 pandemic as an example, and it's no different. Human behavior is one where at some point people want to unchain themselves and get free. And the risk is that they may be transmitting the virus to other members of the community, or contracting the virus themselves with significant negative outcomes. So human nature is one where at some point people just basically give in. And what they do is they feel that the risk of contracting the virus is low, because we're seeing mortality numbers are being, again, lower than they used to be. But, at the same time, people feeling, I need to get out. And by doing that, they expose themselves, and that's where the setbacks are, essentially.
So schools have been a major topic of conversation. It just was announced that a lot of the counties here in the greater Philadelphia area, eastern part of Pennsylvania, will be all virtual. Is there something where it's a clear-cut answer? All schools should be virtual until we have a vaccine. All schools should do some sort of hybrid, or is it just a case by case? Because we go back to the younger population, kids that are anywhere from 5 to 15, that are either going to be home in a virtual scenario or run risk of being asymptomatic and bringing it to teachers and other staff at a school.
Yeah, so there are two elements here. First of all, the younger generation seems to have I guess, some sort of protection against the virus because the number of infected young individuals is very low, and the number of mortality within that young individual is also extremely low. So there may be something protective. It could be one of the receptors on the cells of children may not be developed enough as it is in an adult. That's one theory. Now, as far as going back to school, can children carry the virus? Well, they could certainly carry the virus, even though they may not be infected. And does that mean that they should not go back to school? No. What it means is that you need to take all of the precautions we're taking right now in terms of, again, social distancing and making sure that aerosolized virus are protected. The population at risk, from my point of view, and that is my opinion, is not the children, it's the teachers. And the teachers need to be provided with adequate, first of all, resources, meaning PPE, personal protective equipment, as well as making sure that their classes are set in such a way that allows for social distancing. That is not ideal for any teacher who's trying to educate their class, but it is, again, some sort of a safety measure that will allow this part-time education, face-to-face education, to exist. Because if we're not taking care of the teaching population, what will happen is the teachers will get infected, most likely, and therefore drop out of that particular activity, leaving those students again to be home tutored or home educated, and we're back to where we started. So if we're going to open the schools, we're going to do a few things. Number one is make sure that the potential carriers of the virus, such as the children, are again placed in a situation where there's no crowding. But most important is to make sure that there is sufficient protective equipment for the teachers, as well as that the organization of the classroom is one where there's a low chance of infectivity.
How practical is that? We're talking about 7th, 8th graders, kids that are just nasty by nature. That's what a 6th grader is. They pick their nose, they spit, they throw stuff. I was a 6th grader, we all were, and you can be the cleanest of clean, but it's just the nature of a kid. How do you curb that in a practical world?
Well, again, I think that children, like adults right now, sensing that the norms have changed. And that has to be addressed within the classroom. And to make children understand that what was yesterday is not acceptable today because it may harm people. Now, reason doesn't always play, but you're going to start with that. And then at some point you have to do other things to make sure that people follow the rules. Again, I'm not sure how when you're saying practical, I'm not sure that we're looking at practical, because if we're looking at the last 4 months, right, there's no practical. Nothing is practical. Everything is upside down, and we're looking for ways of protecting each other from this virus. And the children are going to have to partake in it, just like any other. any other situation, which is a catastrophic event. Now, that requires, again, a lot of skills, which many of our teachers have, but at the same time, we can't rely on the children following the rules. We have to make sure that the teachers, regardless, are protected.
That's a great point. Are we at a point right now, and we could end on this, overall, are we at a point right now where by encouraging and having more and more people in the population wear masks, by also balancing out that so many people are just fed up with staying at home, if we could nail that Venn diagram of saying, all right, if you're going to go out, you wear a mask and people follow that, are we at a point right now where 2-3 months down the road would see a significant difference and maybe be back to where we were when the country first reopened, which seemed to be a positive step?
I think that if people following the rules of distancing and mask wearing, I think what we're going to be seeing is at least a flattening of this curve. And hopefully by the flattening of the curve, we may see again a reduction of this curve. Everyone is very hopeful. Everyone is optimistic but cautious about getting a vaccine because it may not be the answer. Because keep in mind, getting a vaccine is the first step. Second and third step is producing the vaccine and then the distribution and making sure that everybody gets vaccinated. So that's a long-term event. So right now, I think, again, these simple measures may, again, flatten the curve for us on the second cycle. And hopefully that will help us reopen all of the activities that make that make society function.
So the vaccine thing, real quick, it seems to be problematic for when people try and downplay this virus by comparing it to flu deaths, because there is nothing that would prevent mass death or what we've seen from different types of populations without some sort of vaccine, as opposed to the flu, where sure, it's still going to hit highly susceptible parts of the population, but it seems to be a pretty big detail that's left out when people compare the damage that's done to the flu or by the flu each year versus where we are now with a virus that doesn't have a vaccine.
Well, I think that may be an issue as you bring it up. I don't know. I don't think we have any or enough information to make a statement. What we do have a concern right now is that we're at the doorsteps of the flu season. And what the flu looks like during a pandemic with COVID-19, we have absolutely no idea. And whether these two together make for a new surge, if you will, of different illnesses with different difficulties, all that's up in the air. We don't know, but we're certainly concerned.